We have 10 APPE rotations, each 4 weeks in length. 6 of the rotations are core and 4 are elective. The 6 core rotations are 1 in community setting, 1 in an institutional, 2 acute care, and 2 ambulatory care. The 4 electives can run the gamut from academic research to specialized part of practice, infectious disease or critical care. But 2 out of the 4 have to be in direct patient care. Interprofessional education means working with a team for the benefit of the patient. That includes physicians, nurse practitioners, but also includes social workers and other quote-unquote non-prescribers who ultimately work towards the best experience for our patients. So for our students to be involved in a team like that, it provides them with a better understanding of how to care for their patients from an economic perspective on what medications can we send them home on, to understanding the perspective of how a nurse or a physical therapist or a physician is approaching the particular concern or the question of the patient. We do a lot of site visits, so we vet our sites beforehand. Our sites and preceptors fill out an application to become preceptors, and part of that is asking about the setting and the kind of interactions that happen at the setting. We also visit them in person, and then we ask our students in their evaluations to, when they evaluate the site and the preceptor, we ask them questions about who they worked with as far as other healthcare team members or people who've cared for the patient in the setting that they were in. I don't think recruiting is going to necessarily be a challenge. I think not in terms of numbers. I think the challenge is in the university engaging the sites in showing them the value of the students and how they're an active member of the healthcare that they're providing at their sites. And I think sites that realize that will be eager to have the students rather than for us to try and convince them. So we do a call out to our preceptors first to determine their availability, and then once we've finalized that, we push it out to our students. We give them approximately a month period to look through the research center and make their selections. We try and add as much information as we can about the sites and the type of experience that will be there, and customize it to the preceptor as well. So the students are making their informed decisions about it rather than just picking the site that's closest to home. And then after that, we run the match through our ex-preceptor, and the results for the most part, we're getting anywhere from 85% and above match with the student selections. And then the oddballs out, it's just a little bit of a manual correction or getting them something that's closer to what their initial choices were as far as type of rotation or health system.